Most of us have an image in our mind of what a heart attack looks like. Typically, we see a man clutching his chest in pain, but women are also at risk. And for women, heart attack might not feel anything like what we've been taught to expect. The Fox Medical Team's Beth Galvin has a look at the signs that you need to watch out for.
You've probably heard the statistics. Heart disease is the leading killer of women, claiming more women than all of the cancers combined. But many women still don't realize they're at risk or that they may experience very different symptoms from men.
Every 43 seconds in the U.S., someone has a heart attack, and most of us think we know the drill. The crushing chest pain, the cold sweat. But WellStar Health System cardiologist Dr. Mindy Gentry says if you're a woman, your heart attack may not feel like you'd expect.
The big difference and where we see it vary between men and women is that men are a lot more likely to have the classic kind of chest pain right in the middle of the chest that gets worse with physical activity and gets better with rest. Women, although they can have that type of story, are more likely to have atypical symptoms.
So instead of the crushing chest pain, women are more likely to feel pain or discomfort in other areas like their jaw, shoulders, back, or stomach. And they may have more subtle symptoms like nausea and shortness of breath. Or instead of dull pain,
women are more likely to have sharp pain, which we typically don't think of as typical for heart related pain.
Dr. Gentry says we don't know why the same blockage in the same blood vessel can trigger very different symptoms in men and women.
We're all wired differently. Some people we find that have had heart attacks and never had any pain at all. So some people are wired where they just don't feel heart pain.
And because women's heart attack symptoms may not be what they expect, they may delay getting help. The American Heart Association found only 65% of women surveyed said the first thing they do if they thought they were having a heart attack is call 911. And Dr. Gentry says women are more likely to die from a heart attack than men.
There are probably a lot of reasons for that, but one of the reasons we think is that women do respond differently to medications. Most of the data that we have on heart disease, particularly on how we treat heart disease, most of those studies are done on men.
And women and men share many of the same risk factors for heart disease like obesity and smoking and diabetes and high blood pressure. But women may have some unique risk factors tied to things like menopause and stress and depression. So talk to your doctor about your risk factors and what you can do to lower your risk of heart disease. For the Fox Medical Team, I'm Beth Galvin.